Thanks again for talking to the Op Report, Dr. Gusani. Please tell us about Pancreatic Cancer Awareness Month and tell patients about the pancreas.
Oh, thanks, Chris. It's a pleasure to be on again on the Op Report. As you can see, I'm wearing purple because November is Pancreatic Cancer Awareness Month, and we try to raise awareness for this deadly cancer. You know, pancreatic cancer is the ninth most common cancer diagnosed in the United States, and about 40,000 people are afflicted with this each year. But it's actually the third most common cause of cancer death in the United States, and so it's a very aggressive malignancy. And the more we know about it, the better.
What does the pancreas do?
Good question. So the pancreas is a long and skinny organ. It's kind of shaped like a fish, Chris, as you know. And so we name the parts of the pancreas for the parts of the fish. And the head part is the business end, kind of toward the center of the abdomen, in the back, behind the stomach. And that's where all the ducts empty into the intestines, and where a lot of the work of the pancreas is done. And then it extends back into the left, and you have, like parts of the fish, you have a head, a body, and a tail. The pancreas does two major things, Chris. It produces insulin. A lot of us know about insulin because it's the hormone that helps us control our sugars. And so those of us who have a lack of insulin, or our insulin doesn't work we have diabetes and we have trouble controlling our sugars. So the pancreas makes hormones that control that control sugars, and the pancreas makes enzymes. This is the other function of the pancreas, and these enzymes are formed in a series of glands throughout the pancreas and flow this way toward the patient's center of the abdomen, and they empty into the intestines and help us digest fatty foods.
Very good. Now, who needs to worry about pancreatic cancer?
A lot of us do because it is the ninth most common cancer. The major risk factors that are identified are smoking and obesity, and of course advanced age. So as we get older, we're all at risk. There are a few hereditary syndromes, so people have a genetic predisposition to pancreatic cancer, but this is not the most common form. So most patients who have pancreatic cancer do not have relatives who are afflicted with the disease. Being aware of pancreatic cancer means kind of having awareness of your body, and if symptoms aren't right, kind of having them looked at.
And what are the symptoms that would be concerning?
Well, unfortunately, pancreatic cancer often presents late, and patients have advanced disease. But the most common symptoms we find, the chief among these would be jaundice. And jaundice is a yellowing of the eyes and the skin that's accompanied by itching. So patients will often have itching before they even notice the yellowness. And this can be a sign that the ducts within the pancreatic head are blocked, and the bile and the pancreatic juices are overflowing. Other symptoms include weight loss, early satiety or difficulties eating much, maybe some nausea and vomiting, and pain that starts kind of in the center here and goes directly to the back.
Okay, good. I mean, not good. But tell me what I do if I have those sort of symptoms.
Well, again, I think it's important to know our bodies, and symptoms that last a day or two and go away may be nothing more than dyspepsia, reflux disease or indigestion. But if symptoms persist, I think it's important to get to a physician and then potentially to a surgeon who can look into these things. In older patients who do develop jaundice, the yellowing of the eyes, we have to always be thinking about pancreatic cancer, and so often we'll get imaging to look at the ducts, the bile ducts, the gallbladder, and then the pancreas as well.
So everybody in my family has cancer. There's a breast cancer, there's a colon cancer. Do I have to worry more about a pancreatic cancer?
Not necessarily. Again, there are some syndromes where families are afflicted, but usually those families have multiple relatives with pancreatic cancer. Occasionally, pancreatic cancer can be related to breast cancer genes, such as BRCA, but again, that's very rare. Most people, breast and colon cancers are so common that may not necessarily reflect a syndrome that makes you at higher risk, Chris.
What else do you want patients to know about pancreatic cancer?
Well, beyond awareness of their bodies and symptoms, I think it's really important that there's a lot of nihilism out there about pancreatic cancer. People think this is a death sentence and this is a disease that has no good treatment. It's better to not get seen. And I think it's really important that we get rid of that myth. Not only do we have excellent treatments for cancer, in an earlier stage we can often cure pancreatic cancer, but even if we can't, there are excellent treatments to shrink the disease, to try to keep it at bay, and most important, to control the symptoms. And I think that's the key, is that even if we can't cure the patient, we can control the symptoms and make their quality of life much better. And that's something that we ought to focus on and let people know about.
So the treatment has gotten better over time, and when we used to think about it being a disease that everybody died of, that is an image you'd like to change of pancreatic cancer?
Yeah, like I said, it's still an aggressive disease, and a lot of people do have advanced disease. But every type of treatment we have, surgery, chemotherapy, and radiation, has all advanced. We have newer drugs, we have newer surgical techniques to do these operations safer and in a more minimally invasive way. And on top of that, we have much better ways to control symptoms and to keep the disease at bay and keep patients comfortable, even if they are diagnosed at an advanced stage.
Great. Thanks for talking to us again, Dr. Gusani.
Thank you, Chris. It was a pleasure.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.